So the session is titled Mobility Trends and Research Needs Due to Impacts of COVID-19. The COVID-19 pandemic has caused unprecedented shifts in when, where, and how people travel. This session will bring together experts representing a breadth of different modes to discuss trends and identify emerging research needs due to these changes. Each speaker will have 15 minutes to present. And if you have specific questions for that speaker, you can ask them. We're going to limit it to 1 or 2 questions at most. And then we'll have general questions for the panel, and Mike and I will field those questions to the appropriate panelists at that time. Our first speaker is Kelli Badesheim, and she's the Executive Director of Valley Regional Transit, the regional public transportation authority for Ada and Canyon counties in Idaho. Kelli began her transit career with Boise Urban Stages in 1994 and became the Director of Valley Regional Transit in 2000. She is on the board of the Community Planning Association of Southwest Idaho, as well as serving as President of the board of the Community Transportation Association of Idaho. Kelli is a founding member of the Treasure Valley chapter of WTS International, which is an association dedicated to the advancement of women in the transportation industry, and was awarded WTS Woman of the Year for 2014 from the Treasure Valley chapter. She is also on the United Way Treasure Valley Community Impact Leadership Team and a member of the Board of Directors of United Way of Treasure Valley. Kelli is a native of Boise. She holds a bachelor's degree in psychology and a master's degree in public administration from Boise State University. Welcome, Kelli.
Thank you, Matt. Thanks, everybody, for participating and giving me an opportunity to participate in this conference. I have to confess, I struggled way more than I usually do with creating a presentation for a conference, and I realized as I was trying to focus all my attention on the kinds of activities we've been doing over the past 7 months with the pandemic response, it's that it was really hard to put things in a nice, neat time frame, and it's just been so chaotic. So hopefully it'll come across in an organized way. So I'll start with talking about Valley Regional Transit. We are a 2-county regional public transportation authority, also in Ada and Canyon counties, Southwest Idaho. We were formed by citizen referendum in 1998, and we're governed by a 29-member board, which I think might be one of the largest transit authority boards in the country. Most of our boards are elected officials from other jurisdictions, and we have a few appointed officials, but most of them are elected officials representing the cities and counties and other jurisdictions. We serve a very diverse population. We have large urban, suburban, rural, all within our 2-county boundary, population of about 710,000. Matt already mentioned that we have no dedicated local funding source, so all of our local funding, we're very reliant on federal dollars, and all of our local funding are voluntary contributions from local governments. And our annual budget's about $25 million a year for operations and capital. So give you a little background in Valley Regional Transit. Let's see if I can advance the slide. So 2020 was going to be a banner year for Valley Regional Transit. We had new programs we were launching. A couple we had launched just in a big program in our downtown Boise area. We had launched in November. We were getting ready to do service enhancements, extending service out to some of our smaller suburban communities in Eagle, and expanding services throughout the network that we were supposed to launch in March. We've just been doing a lot of work, and I want to direct you all, if you haven't seen our plan, it's Valley Connect 2.0. It's on our website, and our web address will be at the end. It's, sort of set the stage for all the work that we've been doing the last few years. And this was going to be the year that everything kind of started to launch on all that hard work. So we felt this disruption when it occurred in a real way, and basically put the brakes on a lot of things. And I'll kind of talk through that as we go through the rest of the slides. So one of the first things we did was realize that we needed to come up with an action plan. And so we developed some guiding principles around that, because we knew that this was going to be something that we would have to put some deliberate and direct attention to. So we developed our guiding principles and thought about them through the lens of our immediate needs, which we defined as, what do we need to be doing today? What do we need to be doing tomorrow and this week? And working through the stay-at-home process. Then we started looking at, well, what happens to the end of the fiscal year? And it got a lot murkier as we were trying to think of what's going to happen beyond that fiscal year. So we did a lot of focus area discussions, SWOT analyses, all kinds of ways of sort of mining from the staff's perspective, what are those things we need to be focusing on now? And then identified our guiding principles for how we were going to invest dollars. One in direct response, which was really covering the expenses and any lost revenues directly related to the pandemic. Then our resiliency, which is investing in projects that build resiliency. And Matt pointed out, none of us know when this is going to end. So we figured out pretty early on that we may have to be prepared for future disruptions. And then the last category is our strategic direction, where we want to ensure that we could begin to or continue to carry out all those strategic investments that we established prior to the pandemic. So by having this way of organizing our work, it helped us to stay focused and to address the most immediate needs at any given time. So the way I've got the rest of this organized, again, I was trying to think about how to do this. Do I do it through the phases we've been through? And that got challenging because we're in different phases in 2 of our counties, and we're one day you're in one phase and then you're suddenly having to respond to an increase in cases. So what I did is more separated it by the types of disruptions that we experienced. So these are organized by kind of stating the disruption and then some of the things that we have done to address those. And then as I get to the end of the presentation, zeroing more in on how we're responding going forward and what might be some research opportunities. So the first disruption was really in the safety area. We immediately had to change and create new sanitation and safety protocols. And as Matt had mentioned, people were being told to avoid public transportation. A lot of people have to use public transportation to go to work. And our goal was to try to maintain as much service as we could safely within the CDC guidelines. So we started by developing and implementing these immediate safety protocols. We found that some of our services, with the reduction of utilization, we were actually able to redeploy some of those operational labor, bus operators, to help us with additional sanitation on those routes that we maintained. We also instituted mask requirements later in the spring, and now those are all mandatory on our services, and installed safety barriers so that we could make sure that there was a barrier between the bus operator and the passenger as they were boarding. In operations, we were trying to address these changes in real time. In our state, we were in, they called it Rebound Idaho Plan, and we were in phase 3. We moved to phase 4, and a week later, Ada County went back to phase 3. So we were always having to address these real-time changes to service levels, and our operations people just did an excellent job of monitoring that, making sure that we had the right level of service to deliver, and also ensuring that we could do that in a way that maintained social distancing on the vehicles. So one of the first things we determined we needed to do was to suspend fare collection, and shifted where we could to backdoor boarding. So again, creating that distance. We had X's on certain seats that we wanted people to avoid. So it sort of forced people to have space between them. Because there were so many fewer people going to work, it really wasn't that hard for us to create that social distancing. There were some routes we added extra vehicles to so that we could, and just had them going more frequently so that we could make sure that we could have the social distancing. We learned very early on the inadequacy of our scheduling technology, which is really the brains, and it's the focal point of all of our technology, ITS, intelligent transportation systems. And that was one of the most disruptive things for us, because it was hours of work every time we had to change routes or make adjustments. And that we also ensured that operations had the agility to adjust routes in the moment. If they needed to add a bus, they added a bus. So it took a team, and we were able to address all those operational issues. The next area that we saw the most significant disruption was in ridership. And this happened all over the country. I think we were right in about the average of where the ridership drops that I've heard anyway, around that 35%. People were staying at home. We were encouraging people, even with signs on the bus, that if you don't have an essential trip, don't use public transportation. We also learned in this the importance of transit to essential workers. And we have, through our local United Way, there's lots of data on this category of worker called ALICE, which stands for Asset Limited, Income Constrained, Employed. And what we've really learned is that it was those essential workers that were keeping this economy going for those first few months. And our region really valued the role that public transportation played in that. We also need to be thinking during the pandemic and into the future, addressing social equity and disparity issues that come about when we are requiring people to work and saying they're essential, but also we have to have the transportation to get them where they need to go. And many people were disrupted by the reduction of services. The bus might not have been available at the time that they wanted to go or in their neighborhood. So we need to be considering those things. Also, again, I mentioned managing those service levels in real time. And so far, we have had, with all those different protocols, we have had no known cases traced back to public transportation in our system to date. So we feel really good about that. One of the other, and again, all these things are big disruptions, but this one we spend a lot of time internally talking about. It's this idea of and this was one of our big initiatives this year, was to launch a big marketing campaign to try to bring new riders to our system. We were expanding our services. We've been using a marketing firm to kind of shore up our fundamentals in the marketing area. And suddenly everyone was being told, don't ride transit. We actually suspended our service enhancements, even though those services could have helped people. We suspended them just so that we weren't contributing to that mixed message. And that was very early in the crisis. And there was all these messages about transit not being safe and avoiding it. So we shifted our marketing resources to crisis communication, and making sure that those who were riding knew how we were addressing their safety concerns, employees knowing how we were going to address their safety concerns. And then we've also developed and launched, as people were starting to come back, this campaign called Safe Travels Treasure Valley. And that campaign is, it's Valley Regional Transit, along with other transportation providers in the area, have collaborated to help people understand how to travel safely and to help alleviate some of those concerns they may have about public transportation. And I will say that we've seen our ridership coming back, I think, at even higher than a lot of systems, because we are carrying so many of our passengers are essential workers. And so we've seen that a pretty good bounce back. I think our ridership is down maybe 10 to 14% compared to last year in the same time. We've also built agility in our communication and marketing tactics for 2021. So we have money set aside to develop a campaign, but we want it to be informed by whatever is happening at that time. And as we've said, and I know all of you have experienced, the lack of certainty of the future makes those things really challenging to accomplish. And then the other public perception issue is just the information that our local funding partners may be making and the assumptions they may be making as they're making funding decisions with incomplete information and uncertain times, as Matt mentioned. The next area is in disruption that we've been addressing is economics. We, as I said, we suspended our fares, so we had an immediate loss of fare revenue. We had just done a fare increase in October, and we're having some of our better, we had increases for year over from last year, just based on our fare increase. So again, we thought we were heading down we knew we were heading down a completely different path by the time this thing started. We also have taken in-house our advertising revenues. This was the first year that we were, that I think it was our second full year of doing our own internal advertising revenues, and had projected having about 500,000 in revenue, and that was completely disrupted and reduced. We had to work closely with our funding partners. Most of our local governments had already provided their funding for this year, so we really didn't see a lot of disruption that way. But as we're thinking about the future and trying to understand what their particular conditions are and what they're projecting going forward. And then we were very fortunate that we were a recipient of the CARES funding. We got that in about April. We immediately turned around and wrote a grant, and the main purpose for the CARES funding was to ensure that we could deal with the economic impacts, the sanitation needs, you know, the direct response to the pandemic, as well as addressing future economic impacts. So that's those dollars are available to us at 100% federal match. And then we from that started really thinking strategically about not just this year and next year, but our next 5 years. So we are thinking about our investments in a 5-year period of time, and we have set that planning process, that spending plan or investment plan, around those guiding principles of direct response, resiliency, and strategic direction. So resiliency is really the sort of the key organizing element of all of our work as we've addressed the pandemic issues. We are in the process of putting out, I think we've just actually selected a vendor for an integrated fare payment system. We'd already planned on procuring that, but with the existing or current situation, we included contactless fare systems so that people can board the bus without ever having to touch the fare box. We are updating, one of our projects will be to update our scheduling and dispatching technology. As I mentioned earlier, that was really one of the big disruptions and time-consuming activities, was updating those GTFS files every time we had to make a change. And we want to include on-demand transit. We just launched an on-demand transit pilot in Canyon County, and think that it's got some real potential as a solution for adjusting to these disruptions in service, where we may need to reduce service levels, we may need to increase service levels, and how we can make service as convenient for the customer as possible. I think based on the perception issues, we're also going to have to make everything we do very human-centered, very customer-centered, to make sure everything we do is really addressing those needs of the customer. Another plan that we will be doing to build resiliency is what we call our integrated mobility plan, where we're really looking at the mobility management, Other ways it's phrased is mobility as a service. It's how do we connect all these different modes? And aligned with that is this idea of a mode choice research, which is also considering the role of micromobility, shared mobility through the pandemic as well as beyond. I mentioned our marketing and communications campaign. We'll continue to bring that forward, and that will evolve as we get more information on our circumstances. We also are going to be doing a non-rider survey. We try to do these every few years, but this one's going to be really important because we're going to need to assess and address and understand some of those safety concerns and perceptions that people have. So that'll be a great way for us to be able to do that. And then also identify the most important projects that cut across all of these areas of disruption. So to bring this back around to the idea of future research opportunities, I think the biggest is how can technology help us to adapt and to create agility? That if I were to identify our biggest Achilles heel in all of this, it was that our technology is not designed in a way that can adapt in that quick way. Adding more mobility on demand, that is something we're really pleased with the results we've had so far in Canyon County on our on-demand transit pilot. Getting that traveler information and fare payment systems developed so that they're very seamless and friendly to the customer. Matt had mentioned the idea of autonomous vehicles and what role does autonomous vehicles possibly have in making transportation more available, more environmentally friendly, and more cost effective. We are very interested in anything about modal integration, especially when we look at that fixed route as the spine, as the core of the system, and how does micro and shared mobility affect that as well. And then also support for collaborations. I mean, the data that's needed to really think about that nexus between housing, transportation, health, and jobs, because we really need to think about who are needing these kinds of services and what are they needing them for. And one of the issues that's happened because of our tremendous growth, people are moving farther and farther away from jobs, which also means they're having harder time accessing healthcare and making sure that transportation is affordable and the cost of transportation doesn't prohibit people from being able to get to jobs. So hopefully I stayed within my 15 minutes, but I will put my last slide up. This is my contact information and also to our website if you want to get more information on our plan Valley Connect 2.0. And thank you for your attention.
Thank you, Kelly. If you can move the slide off of sharing, screen sharing, then we can see you. We've got one question, we've got a variety of questions actually. One person is asking, who's the audience for potential on-demand services?
So that is really everyone is an audience because we're deploying it in Canyon County, which is part of our region that has invested very little in public transportation. And this was our attempt to disrupt this cycle of failure in Canyon County, which was we weren't achieving the ridership the funders wanted, so they would cut funding. So then we wouldn't achieve ridership and they would cut funding. So we completely upended that model, and it's been really effective where you have low productivity, low ridership, but you have a pretty broad-based audience to serve. And there isn't a particular audience, it's really public transportation on demand.
Okay.
I was going to jump in with a question that I received. And so again, to the audience, please use the question and answer as a chance to ask Kelly a few questions. We'll take 2 or 3 questions, and then we'll also do a panel with all 3 at the end. One question that I received, Kelly, you mentioned that there were some investments that you made with contactless readers and a couple other investments. Well, can you say a few more things about this? Is this, did it just move your priorities up? That was funding that was down the line, or did you use emergency monies? Or are you sort of ahead of your program of funding in the next couple of years? Or what can you say about that?
Well, because we've arranged our work around this idea of mobility management, mobility as a service, and really very human-centered approaches to our technology, we had already planned to launch an integrated payment system. So that we just, it's in deployment. We've just engaged the vendor, the technology vendor for that. We were able to, because we were already putting that out for RFP, we just added that element of contactless fares. We were already getting ready to change or to update our dispatching technology. This is now giving us the money to forward that. Because of the CARES dollars, we're able to forward those projects. So these are all things that have been in the hopper. We just are seeing the value of how they can help us address these disruptive times.
Got another question. How are you identifying your non-riders for the survey?
We do that through, we hire a firm that does research, that kind of research and polling. And so they have their own methodology for doing that. So it's similar to how any polls are conducted. And we just do it to a certain number of households, and then those households identify as whether or not they use transit or not. I think our region maybe only carries about 1% or less of our population on transit. So it's really not that hard for us to find non-riders in our surveying.
Kelli, you've seen a lot of change in the last couple of months. Do you think some of this might be a change in behavior, and like long term, that people found new ways to travel and they might go, oh wow, I never knew I could do this way? And how do you keep a pulse on the idea that people's behavior might be a long-term change?
Yeah, that's really a struggle. And, I think Matt made really good points about trying that uncertainty. And probably for me, one of the biggest challenges is to not get ahead of making assumptions about how people are going to want to travel. So in many ways, I think we need to stay the course and sort of see how it shakes out. But I've really discouraged our staff from thinking about this disruption as something permanent. We don't even know what the new normal is going to look like. And we just want to be ready, knowing that as I go around our community, I've noticed what Matt's saying, that the traffic is just as heavy in some places as it was before. We still have this disparity of people moving farther away from jobs, and they may not have the ability or the income to afford their own commutes.
Mike, do you think we have time for one more question? Or
Yeah, maybe you want to do that micromobility one that came up?
Yep, that's the one. So Kelli, micromobility, mobility as a service, and mobility on demand are well suited for autonomous vehicles. Do you anticipate that this will be adopted by your transit service, or will it strictly be a private sector approach?
We are actually very open to any and all ways of deploying all kinds of things. So as a transit authority, we don't actually directly operate much of anything. We contract most of what we do. So that's part of the analysis. Anytime we bring on a new transportation solution, for example, our fixed route is operated by a private company, First Transit. The vendor that's providing the on-demand transit is a technology company, and they're working together to figure out how to deploy this service. We have a relationship with Lyft, and we call it Lyft Connections, and they're doing first last mile to transit. So we've just been really open to trying new things and working with different partners, and we don't make any assumptions about the best way to deploy or to deliver a service until after we've been in the design process.
Yeah, I was speaking with someone from Portland who was mentioning this phase that micromobility has gone through. mobility services have gone through have started off being just sort of letting them do what they wanted to do. Then it was a phase of regulating it, and now it's entering a phase of really partnering with these services. Yeah. So I just wanted to touch on, if others have questions, we will do a full panel question and answer at the end. So we appreciate Kelly's presentation. Thank you, Kelly. Again, you have hundreds of people clapping right now for you.
Thank you.
And Matt, if you'd like to proceed and go ahead.
Yep, thank you, Kelly. So our next speaker is Susan McLaughlin, Urban Design Manager for the Seattle Department of Transportation. Susan has 20 years of urban design and planning experience and has previously worked in Santa Barbara, California, Sydney, Australia, Rochester, New York, and Christchurch, New Zealand. She has an undergraduate design in environmental studies from UC Santa Barbara and completed her master's degree in urban development and design in Sydney, Australia in 2008. Susan is currently the urban design manager for the Seattle Department of Transportation. Her team advocates for better urban design and complete street solutions on transportation and public realm projects, and more recently has been leading a team that has been assessing the department's response to COVID and the city's recovery strategy. Welcome, Susan.
Thank you so much. It's a pleasure to be here. I wish I could see everyone's face, but this is the best we get. So anyway, happy to be here. In terms of this will be a valuable discussion. So looking forward to the questions at the end and the panel discussion following. I'm going to go ahead and bring my screen up. Okay, so as Matt mentioned, I work for the Seattle Department of Transportation, and as part of that role, I manage both Complete Streets projects, which basically were mandated at the Seattle Department of Transportation to do a complete streets assessment on all of our capital projects, and so I get to evaluate and be involved in a lot of capital projects. But I also manage a lot of public realm projects in terms of bettering public space and understanding how we can continue to improve the public realm for the purpose of meeting one of our values of livability. And so the impact of COVID-19 has been significant on both the mobility front and the public realm front, needless to say. And I knew that given how busy my fellow colleagues were at the onset, at the first response phase back, in March, that we were going to need a prioritization framework to understand how we can be most effective for the Department of Transportation in this recovery realm, understanding the decline in municipal funding that we were anticipating, and also we had an impact on our crew availability and the ability to actually make changes in the right-of-way, build those construction projects, because we had limited capacity on the crew due to workplace protocols. They couldn't work together, they couldn't use the same trucks, and also many were part of a vulnerable population in which they could not come to work at all. And so I'm going to run through our approach to creating this prioritization framework and our efforts as part of the recovery. And so first we had to understand, for a Department of Transportation, we had to be humbled. I guess here I can minimize this. We had to be humbled by the fact that people's recovery extends well beyond transportation, right? People were losing jobs, people were losing family members, people were struggling for childcare, to get childcare and to get around. So really understanding what is SDOT's role in COVID-19 recovery, how has it impacted mobility, access, and public space? So that was part of our first kind of research project, so to speak. And then we wanted to identify strategies within our toolbox to foster recovery that also aligned with our SDOT's long-term goals and values. And then finally, as I mentioned at the introduction, we needed to find a way to prioritize funding in the areas that were most impacted to really maximize benefits, recognizing those resource constraints that we anticipated. Okay. So we dug into the 5 key challenges, what we saw as 5 key challenges of COVID-19. First, the disproportionate impacts of the virus. I'm going to get into that. Two, changes to how we get around. Kelly talked a little bit about that. So I'll talk a little bit how that affected Seattle. We're going to talk about the increase in public space needs to meet physical distance protocols, the impacts to local businesses, and lastly, our City of Seattle's budget constraints. So first, starting out with the challenges associated with inequity. This is a big one. And at the onset of this work, which started back at the beginning of the pandemic, we knew that, that the health inequities of COVID-19 were evident. We were seeing the biggest toll of COVID-19 on the communities that we have already disadvantaged over the years by structural racism. This is, as you can see, oftentimes this is due to underlying health conditions, and then intergenerational living as well. And then part of the, as Kelly mentioned, a lot of that workforce being essential workers as well, needing to continue to go to work every day. In terms of Seattle, we saw the highest rate of cases in Native Hawaiian Pacific Islanders. So that's the bar that you see on the right hand of the screen. And then second, Latinx community, followed by Black residents. This is from King County Public Health data as of early October. And then mobility shifts. This is a significant one. I mean, this is obviously the bread and butter of our work. All of you professionals, this is probably what you're most interested in. We've talked a little bit about already. But really, Seattle saw a huge decline, to be honest, with public transit. Initially, at the beginning of the pandemic, we saw a 62% decline in King County Metro ridership, 62%. So that's significant, including, and this is not on the screen, 85% of Sound Transit, which is our light rail provider, 85% reduction in early in the pandemic on light rail. So I have on the left of the screen, here's our 2019 mode splits. We were well on track for meeting our mode split goals with only 26% of a drive alone rate. And you can see that over 50% of our trips were covered by shared trips, either by transit, carpool, or vanpool. So the pandemic has really shifted with that huge decline in public transit. The risk is that over time, it really will start to jeopardize our goals, our climate goals, and our economic goals relative to our drive alone rate. Our ability to grow sustainably in our downtown core will be adversely affected if we don't come up with mobility solutions to offset the decline in transit ridership. And in terms of transit ridership, you can see the decline here. You don't even need to get close to the screen to just see the trends. It was a rapid decline, March and April, and then a slow uptick. The green line is bus ridership, and then yeah, so you can kind of track bus ridership has not really improved substantially, and certainly light rail has not as well. So what's happening with traffic? The traffic volumes overall are still on the decline. So these are screen lines, though. It's important to note these are screen lines that are really coming into and out of the downtown core in Seattle. And of course, this aligns with the huge amount of telework that we discussed at the beginning of this conference, which has been discussed many times. Our decline in traffic, particularly you can see in April, 60%, is now starting to erode, and we're seeing more people come back in terms of commuting back into the downtown core. I'd like to then couple that. It's interesting when you look at bike counts. Arguably, we have heard, and perhaps anecdotally, that more people are biking. However, when we look at those same screen lines or similar screen lines, we're actually seeing significant reductions in biking. And what worries me is that we're seeing reductions increase as we move further, as opposed to traffic is coming back. Bike ridership is not. And so one would start to speculate why that would be the case. Is it the fact that that people were more inclined to ride when there was less traffic. And if you just look at April alone, I find it interesting. April, when there was a 60% reduction in traffic, you can see from a weekday rides perspective, we had well over 100% increase in bike ridership. This is telling me that people were really appreciating the decrease in traffic on our streets and were taking recreational rides when they could on the weekends. Interesting. It's just interesting kind of findings when you compare the two. Okay, and then this is the anecdotal part of it, but maybe not so much when you look at electric bike sales. Electric bike sales are skyrocketing. There's all the media around basically the resurgence of U.S. bike ridership. Bike sales were really up. And so this is all really positive, but I think that's why City of Seattle, because our screen lines and our traffic and bike counts are really focused on commuter, getting those commuter numbers, is why we're seeing we're not seeing that the same numbers align, but I think people are working more at the they're working their neighborhood. They're at their micro neighborhood scale more than in the past. Another challenge is inadequate space. You know, I don't know about your cities, but despite our standards being 8 foot from a pedestrian clear zone and 4 foot to 6 feet for a furnishing zone, oftentimes we have deficiencies in our sidewalk widths. This presents challenges for economic recovery, and certainly at a time when, you know, when we wanted vibrant business cores that with a lot of density of people, now we have to make sure that density of people has enough distance to socially distance. And so this graphic was taken out of the Healthy Business Streets. It was a guide that King County put out in partnership with the City of Seattle to really to provide tools for cities and counties on how to design streets during the pandemic to really allow that social distancing. And then economic impacts. I'm sure every city that's listening, every county, every state that's listening can relate to this. We saw 8.2 decrease in employment, and this is in the Seattle, Bellevue, Everett area compared to last year. Not a surprise, but sadly, many of the small businesses in particular were hit and more vulnerable. I can tell you that, you know, a large part of our downtown with the Amazon presence, there's a lot of feeder industries that relied on those workers being part of those downtown neighborhoods. Those small businesses are being adversely impacted. And then finally, as I mentioned already, the decline in ridership could threaten the local and regional economy as the risk of congestion increases. We saw budget impacts that about $326 million for the City of Seattle for the 2020 budget. But this was compounded by, I don't know if many of you have read the news, that our West Seattle Bridge, which carried approximately over 100,000 vehicles per day, had cracks, discovered cracks in the structure, and we had to close it. That was in early March, the same time as the impacts of COVID were really coming to head. And so understanding how we're going to leverage resources to make urgent investment decisions on the mobility and public realm front during recovery is critical. And so our work, we decided from a prioritization standpoint, how are we going to prioritize capital funding, was based on 3 principles. First, equity first. Prioritize investments and services in those areas most impacted by COVID. 2, allocate the right-of-way based on our desired mode split targets, right? Use this as an opportunity to put the red carpet down for bus service. Use this as an opportunity to reallocate right-of-way to foster safer connections by walking and biking. And then finally, we need to make sure that from an economic resilience standpoint that we're using the right-of-way to serve economic recovery and adapting it as we can to support those local businesses. So first, we needed to do some mapping. We needed to really understand what does it mean to have the most impacted communities. And so we developed a methodology really looking at King County data on the number of cases per census tract, and we weighted that 50%. Then we looked at race and social equity index factors, in which it's a common data set that we use to prioritize many of our capital projects. 25%, and then a displacement risk index, which really took into account some of the economic vulnerabilities in our local business districts. So based on that, we came up with a map, which you can see on the right of the screen. That map really resulted in having us focus on 10 geographies. Not surprisingly, I should say, they're all really generally in the southeast of our city. These are the areas which we have traditionally underserved. These are the areas which has, let's see, 39% of our Black, Indigenous, and people of color residents live in these focused geographies. 56% of all Black residents in the city of Seattle live there, 37% of Indigenous, 49% of Native Hawaiian, Pacific Islander, and 32% Latinx. I say all that because at the same time as we were looking at the pandemic, another crisis really came to light, the murder of George Floyd, and really the city's role, right, in breaking down structural racism was identified almost as much of a pandemic as the COVID-19 pandemic. And so really focusing equity was critical from the mayor's office down to the staff level. And so we understood that we needed to craft a plan that really responded to the plan phasing, response, reopening, and recovery. And then strategies in which we crafted would then fit nicely into each of these. However, as we've learned, we could bounce from response to reopening and then back to response. It's critical for us to be nimble and to be able to allocate our resources in a more fluid way. So what did we do in the response phase? Well, we supported local businesses. On the left side of the screen, you can see that we changed our curb space utilization. We created pickup zones for local businesses, 517 across the city. Signal operations, understanding that we needed to foster more people walking, and with the lower traffic volumes, we adapted 550 intersections to reduce cycle links, to prioritize pedestrian crossing. And then you may have heard in the media, it received a lot of media attention, we closed or opened, I should say, 27 miles of Stay Healthy Streets for biking and walking, for neighborhood connections. And still allowing for obviously resident access. And now we're making headway to make some of these miles permanent. And then finally, this was a month ago, but we had already issued 195 permit applications for businesses to spill into the street, to close the street, to expand their sidewalk cafe, what we could do to take advantage of the summer months and get people outdoors dining. We also supported our healthcare workers by partnering with our Department of Construction and Inspection to reduce fees for those essential workers. And then in partnership with our Parks Department, we closed streets adjacent to our largest parks and most popular parks so that people could visit them and have space to recreate. So I'm just gonna, I know this is small, but I wanted to give you a sense of the strategies and actions that our department developed to respond. And we really, we bucketed these into two categories: move, which is our bread and butter, right? And we came up with 3 broad strategies to prioritize transit riders, and some example of actions I've already mentioned to really accelerate bus-only lane installation. We should be doing that now so that when people do return to transit, that's an efficient ride. We should continue to accelerate that 20-minute, that non-motorized 20-minute neighborhood. This is what people are resonating towards. People are experiencing their neighborhood in entirely different ways. They're walking more. I've heard many anecdotal stories around people taking many more walks in their neighborhood and really enjoying getting to know their neighbors. And then third, helping people get around without driving alone. And so continuing to make sure that we're focused on transit demand management strategies, and particularly encouraging teleworking given our capacity reductions in transit. I'm not sure if this was mentioned, but in terms of King County Metro, we can only accommodate 12 to 15, I think it was 12 to 18 riders based on the size of the bus. And so even if people wanted to return to transit tomorrow, we wouldn't have the capacity on our buses to bring them back down to the workforce in the downtown core. And then finally, Thrive really touches upon SDOT's ability to foster economic recovery, so maximizing space for people, supporting local business, and managing goods delivery. So I moved through that really quickly, but I wanted to let you know what's next. And so now that we have this prioritization framework, we have principles, we have our values, now we're targeting prioritization of operational and maintenance dollars and capital funding in those focused geographies to support recovery, particularly for Black, Indigenous, and people of color, and recovery-related actions in the next 1 to 3 years. We're participating in a broader community conversation, and that's part of a wider citywide recovery effort that the mayor's office is leading. We're really excited about this work because, again, as I started this presentation, recovery does not just start or end with transportation. To be honest, if you don't have a multifaceted recovery strategy that includes economic incentives, housing, homelessness strategies, then we're really not building resilience in the right way. And then third, we're partnering with other departments, like I said, with our Office of Economic Development, our Seattle Public Utilities, on fostering personal community and economic resilience. And just one example of that is, as we're approaching winter, thinking about how we can allow things in the right-of-way that were challenging in the past, heating sources, right? Overhead tents, things that we may have shied away in the past, but really fostering winter outdoor dining opportunities. And so we're launching a design challenge. So that is my presentation. I'm going to stop there. This is just an image of one of our outdoor, quote unquote, patios, outdoor dining locations.
Great, Susan. Do you have any contact information for folks?
You know, it's funny. I don't. I can.
Okay, that's okay.
I deleted that slide. I was thinking in the modern age, most people get it different ways. I'm happy to put it in the chat. How's that sound?
That'd be great. If you can stop sharing then the screen, then people can see it. We've got a couple questions that folks are asking, and just a reminder, the question and answers are open, so please feel free to submit your questions. The first question is regarding the source of what is your source of your bike data?
So like I said, the source of the bike data that I showed in the presentation was literally just screen lines. That's just from our tube counters that we typically use in just a few locations, and it typically indicates commuting patterns. So that's why I take that with a grain of salt, that in the pandemic, people are shifting their mobility patterns a lot. And so the location of our screen lines may not match where people are actually going these days with their bike pattern. Does that make sense? Yeah.
Susan, I have a question here for you. And also, by the way, there was one comment that just said, amazing presentation, Susan. So you're not lying, but you had hundreds of people there clapping for you at the end.
You stole my thunder. I was going to say that one.
You're going to say that too. Okay. So, well, one question I have for you is, this one came to me in a private chat. Someone asked about the programs, the Stay Healthy Streets and the right-of-way dining areas that are going up. Has there been talk about the long-term implementation? Do you see that as like a suddenly an opening of eyes of, hey, we could do our streets differently?
Absolutely, and that effort is already going on. We are making strides towards making some of those miles permanent, some of those 27 miles permanent. We are engaged in community level conversations about that. It's important to note that we're taking our time on this next phase. Whilst some communities really appreciated their streets being closed, the 27 miles of them, other communities would have liked a little bit more community dialogue around how they envision their streets in the future. So yes, the answer is yes. We're excited about the opportunity to, whether you say open streets or closed streets for pedestrian and bike mobility. I think it's really opened a lot of people's eyes to what we can accomplish.
Another question we had was, does the transit fare change for people from the focus of geographies amid COVID-19?
It's a good question. You know, again, I work for the city and not the King County Metro as the service provider. I do know that there was reduced or free fares during the peak of well, I say the peak of the pandemic, I think we're probably still in it, but when transit ridership was extremely low, we had free to reduced fares. I think recently that has gone back up But I think one of the strategies we should explore, and this would require interagency between the city and King County Metro, is how can we keep those fares? And we already do programs like this, but making sure that we're exploring other opportunities to do free or reduced fares for those focused geographies.
So there was a few questions about the bus lanes, and I'm not sure if I fully understand it, but one question is asking about the metrics used to do person throughput compared to vehicles, and with buses at reduced capacity. How does that change with, I suppose, your evaluation and what you're doing? Is the metric still have its value with reduced capacity buses?
Such a good question. So thanks whoever asked that. I'm pretty excited about the work we're doing right now around evaluating person throughput to provide a threshold for when we consider or put down bus-only lanes. We used data, pre-COVID data, when we did kind of a transit flow map, looking at that, looking at the ridership on each of our routes. And then what we did is we cross-compared it to which of those routes still maintained high ridership during COVID. And now what we're going to do is we're going to overlay that with our focus geographies to really understand where we should prioritize bus-only lanes, right? So we really understand which routes had the highest person throughput, and which routes were so critical for essential workers during COVID.
And it looks like maybe our last question. Does the city have a civil rights Title VI office that has a plan for equity analysis? And the person says, I would be interested in learning more about the equity approach overall.
Interesting. That is not my subject area expertise. I mean, I don't know. I mean, we have an Office of Civil Rights, certainly, and I would be happy to take that question carried on. I would say relative to our equity approach, we have a really strong race and social justice initiative citywide, and our department takes that really seriously, and really every project that we approach, we look to prioritize equity and use that on both data driven, but plus and coupled with conversations with our community members to really identify the need. We have most recently a transportation equity work group comprised of external stakeholders that are representative of each of these Black, Indigenous, people of color communities that have been really informing us of their key priorities in the realms of transportation. And that has really helped to inform our recovery strategy at this point too. So I don't know, I didn't probably answer your question around Title VI specifically, so I apologize about that. I'm happy to follow through afterwards though.
And you mentioned earlier that you put in your contact information in the chat box for folks that might want to reach out to you. That would be fantastic.
Yes.
I appreciate you, your presentation and taking the time to meet with us. Hundreds of people were clapping for you.
I heard them, I really did.
I'm going to move on to our next speaker and say goodbye, I think, to Mike. And Anne, pardon me if I mispronounce your name. Anne Vernez Moudon is Professor Emeritus at University of Washington. While a professor with the Department of Urban Design and Planning, Dr. Vernez Moudon instructed students in urban design and research methods. Her work focuses on urban form analysis, land monitoring, neighborhood and street design, active travel and health. The National Institutes of Health and the U.S. and Washington State Departments of Transportation support current research on the built and social environments at the UFL. The research examines environmental influences on physical activity, active travel, eating behaviors, and other health outcomes. Done in close collaboration with colleagues in public health and transportation planning, the research is now based on high-resolution geospatial data on the built environment and objective behavior data. Welcome, Anne.
Thank you very much, Matt. And sorry for, I don't know who gave you this very long introduction, but the other thing is you pronounce my name very, very well, no problem. I'm going to try share my screen now. Thank you for everybody for inviting me. And I'm very pleased to be part of that panel. Obviously, let me see if I can figure out how to put my hold. Here it is. All right, is my screen okay? I guess
Yes,
Matt is.
it is, but it's not in slide present. There it is. There you go.
It's in slide presentation right now?
Yep, slide presentation now.
Okay. So, yeah, I'm glad to be part of this panel. And what I'm bringing here is information that is a little different, and it's really the result of a survey that we conducted as the COVID lockdown was starting. And so what I'm presenting is really the other side of the coin, is what travelers have been saying to us through that survey about their mobility post-COVID lockdown. And this work is part of an effort that is jointly done by University of Washington faculty of students, Puget Sound Regional Council, that's the MPO in around Seattle, 4 counties of Snohomish, Pierce, Kitsap, and King County, and then, of course, PacTrans. And so I'll show you the preliminary results of that survey. The survey itself was pretty much of a convenient sample. We distributed, after developing the instrument, we distributed broadly to not only people working in the Puget Sound, but also working all over the country. And you can see that we had a response of about 4,500 people across the country, but with concentration in Washington State, and actually colleagues at Washington State University and Eastern Washington University also deployed the survey and are doing their own analysis of their results. But here I will talk primarily of the population in the Puget Sound region, and that was about 76% of the respondents, 3,400 altogether that participated in the survey. And most of these participants had been for 5 weeks into working from home, or into at least the partial lockdown. So we collected the data in April to early June 2020. Overall, the survey the presentation that I will summarize here introduces the sample and compares it to the American Community Survey to look at how generalizable the information is. But we looked at our interest of the group who fostered that survey. Our interest is more generally in the commute trip and commute trip reduction, and also the influence of new technology on travel. And specifically, we're aiming at looking at what app-based travel, how that can actually change the way people commute. So in the survey itself, we asked about people working from home. We asked about the family structure, living arrangement, because that has an influence on how well you can work from home, their travel patterns before and after lockdown, change in food access, and change in general activities, whether it's physical activities, screen time for leisure, for sleep time and quality, the general sort of well-being aspect of life under lockdown. And finally, we focused on mental health issues. So comparing our survey participant in blue to the American Community Survey population in the Puget Sound, you see that in terms of age, our survey generally had fewer young people than the ACS. In terms of sex, we have heavy response from female. Heavy. I cannot see. I have to move my screen here. About 67% of our respondents were female, so we are bias towards female. If we talk about education, our population was more highly educated than the general population in the 4 counties. And in terms of income, we also had generally a higher income than the rest of the main population in the region. So housing tenure, pretty similar, although we had a few more people who owned homes than in the American Community Survey. So looking at working and home life, we were very interested in sort of finding the different categories of people in terms of a relationship to their work. And we had the first group at the bottom of this first list here. We had about 3% of the people who were in total isolation, so we did not really survey them. And we had a group of previously not employed people. And then we had a group 3, which was previously working from home. So those could be, in a way, a control group, people who work from home before COVID and during COVID. And we were interested in this population, as I said, as a control, compared to people who were, quote unquote, forced to work from home after COVID. And so we also had a group of a small number of people who worked away from home before COVID and then became not employed or unemployed after COVID. And the 14% of the people worked away from home before and after COVID, and 64% worked away from home before COVID and stayed and worked from home after COVID. In terms of living arrangement, most people lived with a partner. We had about a quarter of the population living with children, a partner and or children. That's quite representative of the US population in general. We had some people living with friends and relatives and 15% living alone. So we were, in terms of relating this, this survey to the work we were doing on commuting, we were very interested in finding out how people perceived their being productive after being forced to work from home. And we wanted to sort of take advantage of that as a natural experiment of saying, if we had more people working from home, of course, we could save quite a few commute trips, and we could affect or reduce commute congestion at commute time, and we could reduce environmental effects related to the commute, et cetera, et cetera. So we were interested in how people felt about their productivity and how they felt about their well-being and their living under these new circumstances. And that's why we asked these questions. And so we said, one of the questions was, did you feel more or less productive during in working from home after COVID? And here you have about 39% said they felt less productive, but 24% were more productive, and 38% felt no change. So that was kind of interesting. It was about half and half, not quite, in terms of really reporting on productivity. And we asked, what conditions did you work under during COVID? Was it every work day that you felt productive, or was it on most days, or just on some days? And so most people felt productive every work day. They also kept regular working hours every work day, and then they spent more time on conference call every work day, of course. So that was about 40 to 55% of the population reacting that way to this question. Now, reasons for being productive, we wanted to understand that. And very interestingly, I'll just relate only to the top responses. The main reason for being more productive was not having to commute. So 85% of people responded that was one of the reasons. And the other main reason was less interference from co-workers. On the other hand, if you look at the responses for reasons for being less productive, the first reason at 59% of the responses was that there was less efficient communications with co-workers. So that's kind of a very interesting situation where on one hand, it's nice not to have to work with co-workers and be disrupted by them. On the other hand, if we're not disrupted and we don't work closely with co-workers, we miss communicating well with them. So typical sort of yin-yang sort of situation, which we want to investigate further in a follow-up survey. Commute trip, another interesting thing. What kind of commute trips did you have before COVID? And that's for the responses are for the population that then ended up working from home during COVID. And so we had a good 28% of that population drove alone on 1 or 2 days per week. 35% of this population was driving alone 3+ days per week. So this is kind of an interesting statistics that tells you, well, those are people, if we could keep some of these people at home, then we could reduce the driving alone commute. On the other hand, we had a very large part of the sample who used transit, 25% 1 to 2 days a week, and 34% 3+ days per week. Now, those figures are not unusual for the Seattle area, and Susan was reporting on that. We have a large number of people who are now working from home but used to use transit to commute to at least downtown Seattle. And so smaller numbers for using Uber, Lyft, and taxi, and then little larger numbers for car and van pools, 11%, 1 to 2 days a week. Fairly large proportion of people also walking and biking and using scooters to go to work. Commute time, pretty obvious and traditional. Driving alone, people spend less time traveling than people who took transit. And then another set of questions were about what kind of shopping people do for bulk shopping of food and goods, occasional shopping for foods and goods, and for exercise. And interestingly enough, only for exercise did people sort of practice exercise once a day or every 2 days per week, whereas the other kinds of shopping were every 2 weeks or maybe just once a week. So they either reduced their shopping during COVID, or the number of shopping trips they took during COVID, or they had the same kind of behaviors before COVID. That we didn't inquire. We asked questions about restaurant takeout, and we saw that in general, most of our population did not use restaurant takeout or restaurant delivery or food delivery very much. Most of them did not use these services, except for the restaurant takeout. We had about 48% use that more, and 38% used restaurant curbside pickup more. But the meal kit delivery or grocery pickup were still in the low proportion in this particular population. Compare to COVID-19, how much has your daily life changed in the following areas? Physical activity, most people had less physical activity. Amount of sleep, most people had either no change or an increase. Screen time, most people had an increase, and sleep quality, most people had a decrease. Mental well-being, feeling depressed, down, depressed, or hopeless. 38% of that population felt that way for several days per week, which is kind of important to take into account. Little interest and pleasure in doing things. Again, half and half, that half the population had little interest or pleasure in doing things after COVID, and the other half did not have very much change in that domain. mental well-being, again, feeling nervous, scared, fearful, tense, panicked, and restless. In these statistics, most of the people did not have much change after COVID, but you still had about 40% of the population or more who felt more nervous, more scared, more fearful, more restless, more panicky, and tenser. So finally, just the results of a model that we ran rather quickly to try and predict what are the sort of predictors of being more productive while working from home under COVID, or having no change in productivity. And what we found is highlighted here in red is that generally the younger population, 18 to 29, the students felt that they were less productive working from home. Faculty and staff also, we had a number of these people responding to our survey, also felt less productive during COVID lockdown than generally. Whereas, I have to see my screen here. In terms of education, the high school people with lower educational attainment also felt less productive than the people who had higher education. So, you know, this shows you that in terms of socioeconomic status, there were major differences in the people who felt just as productive or more productive than the others. And then we were interested in also the other characteristics, which was previous commuting. Interestingly enough, people who used SOV for commuting felt more productive or had no change in productivity than those who walked. So that's a very interesting opportunity that sort of tells us that we have a population who can work from home, and we would report being at least as productive as before, if not more, and that these people are in majority single occupant vehicle commuters. And then in terms of mental well-being, also we saw that the people who of course were more nervous or felt more influenced by COVID felt also less productive. People who spend more time on personal hobbies, on the other hand, felt more productive. Okay, so this is the end of my presentation. We have a full report of that survey available at this link. And just so you know, we are just now about ready to launch a new follow-up survey to look at the issue of maybe working from home fatigue and to ask some of the same questions. So we're going to have longitudinal data on what it means to be working from home for 6 or more months. And then the other focus we're adding on this new version of the survey is to look at essential workers, those people who've had to commute. So we actually are doing several projects to focus on these kinds of people, including planning to do focus groups with them to understand their needs and wants. So thank you very much. I want to recognize the individual colleagues who've been directly involved in this study. Jeff Ban, Brian Lee at PSRC, and Xin Shen and Jeff Ban at the University of Washington, and then Shao Shi, a doctoral student who's been involved in processing the data. So thank you very much for this opportunity. And please don't hesitate to ask me a question or to email me if you need more information.
Thank you, Anne. Appreciate your presentation. We do have a couple of comments that people have submitted. One individual, direct them to your contact information that you get on this particular page. They're asking about who you worked with from Eastern Washington University. And I just again, ask them to contact you at your email address. We had another individual that asked for you to put your link to the survey results in the chat box.
Oh, good idea, yeah.
And then that I believe that same person asked the question or made the comment. It would be interesting to survey living arrangements now and in 3 to 6 months. I know some people have who have moved out of non-romantic co-living spaces because they want more space due to work from home and stay home orders. So do you have any, what are your plans after this, after the pandemic, or 3 to 6 months from now, Anne?
So, well, the second wave of survey, we will ask people whether they've moved and whether they moved temporarily and whether they're planning to move. So we have like 2 additional questions on that aspect, and then then a question, of course, as to reasons for moving. Need for space, need for open space, home space. We're asking them also in the second wave the composition of their apartment, how many bedrooms they have, bathrooms, and then we're asking them specifically also how many people they have in their household, so we can start looking at the effect perhaps of family size and house size on productivity and feeling well while working from home. So some of these obvious questions, we are adding them in the new survey. Anybody interested in that new survey, I'm happy to share it. It's under review by a human subject, but it's totally a public instrument. Anybody who wants to use the same questions is welcome to do that.
Fantastic. And just want to remind folks that the question and answer box is open, so feel free to submit your comments. And if you could stop sharing your screen, then we can see you. And
yeah, no, and I'll do that, and I'll also send that's the only way I can. Let me see, how can I stop?
Yeah, a bunch
sharing?
of us, several of us have already shared the link to the survey.
Okay, good. How can I stop sharing?
There should be a red.
Here, I found it. Sorry.
Thank you. And Cole Kupka is that, did I get your name right?
Yes, you did very well on my last name as well.
Cole, did you have any questions that you wanted to?
Honestly, the question that had popped into my mind was about longitudinal surveys, but you had answered that, so that was great. Thank you.
I'll send you a copy also if you want it.
Yeah, that'd be great. I think so. We're just at about time. I wonder if our other 2 panelists could join us with video, and if any of the audience members might have any final kind of broader questions about kind of the different things you've been hearing today. Give it just a second there.
And one of the, while we're waiting for questions to pop up, one of the questions that the panel as a whole could answer for us. How do you see the interaction of, or the usage of ride sharing platforms and public transportation? Are they in competition from your viewpoint and from folks that you're surveying? I'm trying to turn around one of the questions folks had asked me. I'll let Kelly or Susan start off.
Yes, I can jump in. At least from our perspective, it's something that we've never viewed as a competition. And I think because of how limited our resources are, we've had to embrace that. And we've actually, I can't count the number of meetings where people would say to me, oh, if only transit could be like Uber, or if only that service could operate like this. And so I think it's something that we just haven't had a choice, and we have developed great partnerships with those types of services, and are just continuing to try to find ways of making that connection for the customer.
Yeah, I mean, I would I would agree. It's definitely not a competition. It's between them. It's compatible, and in fact, it's critical. People want lots of choices. I mean, I think we've discovered that the more choices that people give are offered, the more they take them. I think we are just launching our electric scooter program. We have launched it. You're going to hear from Joel Miller later today. I think those first and last mile connections, the more you can offer them, the more people aren't going to feel kind of stranded by where they may need to go and where transit drops them off or picks them up, right? It gives them a little bit more freedom to move. And then furthermore, I think from a Seattle perspective, oftentimes prior to COVID, we'd have peak loads, or we'd have crush loads, you know, and transit trying to get in the morning and get out. And so I think it's really those micro-mobility tools also help us to alleviate some overcrowding on certain routes, and so that we can catch up with demand.
A question we just received: how are you integrating the health and monitoring of transit users, just like entering a business? Are you open to solutions that are touchless but require possibly video ID and tracing?
I know from our perspective, we have not gone down that path. Certainly we have signs on the vehicles that say, if you're not well, don't operate transit. It's in all of our social media. We do require face coverings. We require a certain amount of distancing where possible, and monitor that. But like I said, at least from our experience, we haven't had any cases so far linked, and we'll just kind of have to see how that evolves. And certainly we'd be open to any kind of protocols that make it safer for people to ride.
Susan?
The only thing I would add to that, and again, we're, City of Seattle, we're not the service provider, but I do know King County Metro is making, great efforts to ensure the public feels safe and is safe when they come back to transit or while they're taking transit during the pandemic. And that one of those includes, and I think I mentioned, the reduced capacity. And so really only 12 people allowed on the bus on a standard bus affords a lot of space per passenger. I've talked about that could be problematic as many people return. We want to make sure we can get people on the bus. But I think having that distance, having the face covering is required. During the peak of the pandemic, we're just picking up essential workers because of that reduced capacity. So we had some restrictions on who could actually take the bus at that time, making sure that there was capacity for those trips.
And not that you all have crystal balls, but just to see, what do you guys think the pandemic will change as far as teleworking or use of public transportation in the future post-pandemic?
I would say yes, it will change. How it will change, we have no idea. So, and that's kind of the caution that I've talked about earlier, is being careful not to create a self-fulfilling prophecy by making too many assumptions while things still are so uncertain, and being ready. And that's really where this ties back into the research, is we really need good tools to make us as agile and flexible as possible. And I think that's probably going to be one of the biggest changes, is technology is going to have to help us to achieve those that ability to be able to work in this really disruptive space.
Well, if I may add, in our survey, we had some of our colleagues wanted to add questions about if people missed their commute, because they've heard of a lot of people who miss their maybe SOV commute or maybe transit commute and so on. And I think that, the COVID is going to exaggerate certain trends that were there before. And it's gonna, like people wanted to work from home in the tech industry. A lot of people started working from home, at least on a part-time basis. And so that's gonna continue. But otherwise, probably people will come back to the old ways with maybe more distance between each other, but that's it for a little bit. Yeah.
Yeah, I guess my crystal ball, shoot, if I had to consult with it. You know, I think that people will, you know, we're going to see a variability of work schedules, period. That's going to definitely come out of this. And in fact, for Seattle, that may be helpful. You know, again, I'm going to go back to that. We are having a hard time carrying those peak loads on transit. That's a good success story, in my opinion. But will this allow us to spread the load over longer periods of time throughout the day, because people are flexing their work schedules based on, you know, school or childcare needs. And so our ability to provide service is going to be critical. So my crystal ball would like to think that we're going to continue to invest in transit so that when people do return, it's available to them, it's efficient, and we don't cut those trips on off-peak hours in anticipation, right, of people coming back on those off-peak times. Yeah.
Well, I want to thank Anne, Susan, and Kelly for sharing the information and participating in the panel. And I want to thank all of you for attending it. I'm going to turn it over to Cole because I'm getting the hook that we're already 10 minutes past our time.
Right. Thank you all very, very much. I just have a few quick things as we wrap up, and I'm actually going to share my screen. Is everyone seeing this? Can I get a, okay, great. So I just want to point out a few things that are on our conference website. So Mike had pointed out at the beginning of the conference that we have the whole agenda, and it doesn't stop now. It stops now for today, but then next week we pick up with a series of 4 webinars that are each on different topics and have their own registration links. I would encourage you to take a look at that and to join us next week. And then a few of the other tabs, one in particular, each year, usually this conference is in person, and during our lunchtime, we do an award ceremony. And I just wanted to acknowledge the PacTrans awardees this year. The Lifetime Achievement Award goes to Randy McCourt, who is the international president of the Institute of Transportation Engineers. Sorry, I apologize. Our Outstanding Researcher Award this year goes to an associate professor from OSU, Chris Parrish. Congratulations. The Outstanding Educator Award this year goes to a professor from the University of Washington, Joe Mahoney. And then our Outstanding Partner Award this year goes to the City of Bellevue, who has partnered over the last several years on many projects. And then the last tab I just wanted to show really quickly, in lieu of a poster session, which we usually do at our in-person conference, we've created a virtual poster session where several of our researchers have created videos that summarize the work that they've been doing and that they have done. You can go watch those quick videos to find out more about the projects, and then there are links to those project profile pages on the PacTrans website. Again, I want to thank everyone so much for your willingness to participate. I hope you found this valuable. I hope you will continue finding it valuable into next week. And then we will post the video recordings from all of these presentations on our website, and we will push them out through all of the normal avenues that we advertise things, so that if you'd like to go back and revisit any of the content you've heard, you can do so. With that, I will conclude today, and thank you so much.